This is the Children's Hospital of Damascus, one of Syria's largest public hospitals and one of the few with functioning cancer treatment centers. Outside, on the sidewalk, families wait for hours that quickly become days. Some are waiting for their children to be admitted, and others wait for their children who are already inside. Parents have been banned from accompanying their children to avoid overcrowding. Inside, the picture does not become any brighter. Cancer patients as young as 2 years of age have little chance of survival, but this does not stop them from being hopeful. Many parents know that the road to these simple dreams is rougher than their children think.
I am the mother of Ayub al-Alu. He is 7 years old and he has been receiving treatment for 8 months now. But we're always late for the treatment doses. Sometimes he would have 1 dose when he should have taken 2. Everything is backed up, and every time I come, I find that they have admitted new patients. We can't afford to pay for his treatment, so we have to come here.
Before the war, public hospitals provided free medical care to all cancer patients. But violence isn't the only thing hitting hospitals hard. The Syrian government says that EU and US sanctions on the country have made the work of public hospitals near impossible.
With the sanctions imposed on Syria, we can't get the medical equipment or medication. We can't get it from Europe, which is where we used to get our supplies. And while public hospitals continue to receive all the cases, we can only provide 50% of the needed cancer medication. So we had to ask parents to buy the treatment themselves. The prices have multiplied 20-fold. We're admitting the children, but we can't treat them all.
Many argue that the government is spending on the wrong thing. Children's hospitals, after all, may not be a priority for a country at war.
If we want spare parts for our medical equipment, we can't get them. Most of our equipment is made in Europe and the US. And if we have everything we need, we can't wire the money because all Syrian banks are under sanction.
Sanctions have affected every aspect of life here. Perhaps this is why activists have launched a campaign to lift the sanctions, with posters spread across the capital.
Sanctions have hurt many Syrians, and although they say it's directed at the government, what it really does is make life difficult for everyone in our country. The media only cares for children killed in bombardment, but what about those dying in silence?
A single dose of cancer treatment costs around 700,000 Syrian pounds or $1,500 US, which is what 28 government employees make in a month combined. In the meantime, thousands of children in Damascus alone are waiting for their treatment, as the cost of that treatment is multiplying beyond the ability of a war-torn country. Ala Ibrahim, CCTV, Damascus.